I'm a big fan of arterial lines in the emergency department, but the recent EVERDAC trial has got many of us questioning their utility. This study looked at shocky patients, mainly septic shock, and randomized them to early arterial line placement or no arterial line placement. It was a well-done study, and it found no difference in terms of mortality. So does this make me question my aggressive use of arterial lines? It does a little bit. In patients with septic shock where I'm getting a good blood pressure reading on my non-invasive cuff, I'm not throwing in an arterial line early, even if I'm titrating pressors. But there are still a number of places where I still want that early arterial line. The top reason is when I have a sick, hypoperfused patient where the non-invasive cuff simply isn't giving me an accurate reading. The second place is in patients who don't have vasodilatory shock, which was the predominant form of shock in the EVERDAC study. So in patients with vasoconstrictive shock, like trauma or cardiogenic, I'm still reaching for an arterial line early. Number 3 is if I need a reliable beat-to-beat systolic blood pressure, like with a head bleed or aortic dissection, or if I need a reliable beat-to-beat diastolic blood pressure reading. And finally, there's no change for me in terms of cardiac arrest, where I'm getting that arterial line in early, since those patients weren't included in this study. So EVERDAC does make me question the early use of arterial lines in septic shock patients, but there is still a role in the ED for early arterial line placement to guide your resuscitation.